So the first slide really is to highlight where the term Harlequin is used in other areas. The first image relates to Harlequin type ichthyosis, which is a dermatological condition that is seen in a genetic condition that affects babies where they're born with split, very thickened skin. This apparently is the Harlequin colour, which is a mix between green and yellow. Any rugby fans might be aware of the Harlequin Rugby Club, playing in the top flight English rugby league down south. Any comic fans might be aware of the character Harley Quinn, also the partner to the Joker in Batman films, again with this split pattern in this sort of costume. And last but not least, and of course there are other areas where the term's used, we have the Harlequin beetle, again characterised by this split pattern on its back. So on to Harlequin syndrome itself. It's a very rare syndrome. The literature is really just full of case reports and collected case reports. It affects the autonomic nervous system, specifically the sympathetic trunk in part, and it was only really first described as recently as 1988. Females are slightly more reported than males in the literature, and both paediatric and adult cases exist. Now, the actual pathology is believed to be a sympathetic denervation on an affected side, and this results in paradoxical overstimulation of our sympathetic pathway on the contralateral side. So how does that look clinically? Well, if you look at the image, on the pale side of the lady's face would be the affected side with sympathetic denervation, which leads to anhidrosis and a pale appearance there. Whereas in the contralateral side, you get this overstimulation of the sympathetic fibres and characteristic flushing and sweating. It can affect your face, also arm and trunk. Classically, it doesn't involve the pupils. Actually, one ophthalmological group looked at several cases, and on detailed pupil examination, there was some pupil involvement. So I wouldn't necessarily exclude that, but it might make you think about other differentials. And this can be brought on by very minimal activity. So it can be brought on in hot weather, exercise, which can be very minimal, or even emotion. So it can be quite distressing for patients. In terms of what we do about it, well, the majority of reported cases are benign or idiopathic, but there is a differential, of course, particularly with these rarer syndromes. And so there are a number of investigations that you might want to consider. Of course, it depends on what point you see the patient and how long they've had it. Now, the differential investigations are quite similar to that of you might do in a Horner syndrome. So you might think about imaging the neural axis, looking at any sort of structural or inflammatory causes that could impact your sympathetic fibres. You might think about vessel imaging with the aortic arch and carotids. You might think about a chest X-ray or CT neck and thorax, thinking about a pancreal tumour or a mediastinal tumour, or possibly a large goiter. And then some simple blood tests. Of course, the list here isn't exhaustive. This is just suggested from some of the case reports. And then maybe thinking about some other autonomic nervous system investigations, so lying and standing blood pressures, baseline ECG, and some other things. What can we do? Well, by and large, the treatment is really one to help the aesthetic and maybe the psychological distress of the condition. There is no absolutely recommended treatments, but case reports do report a success of botulinum toxin injections on the affected flushed side. And this often has to be repeated, but this isn't always successful, unfortunately. Another treatment suggested is blocking of the stellate ganglion, where there's an injection of anaesthetic anteriorly into the neck, and again, that often has to be repeated. And then probably the most invasive would be sympathectomy, where they sometimes divide the sympathetic fibres in part or remove part of the sympathetic ganglion. Of course, that's quite an extreme management, and often these cases won't undergo any management. And that's all I have to say. Thanks very much.